I'm Michael Guterbach. I am a senior consultant for Economist Impact, as mentioned, and I believe I have some slides, so we'll wait for them to come up. I just want to talk to you quickly about a Economist Impact program that's called the Vaccine Ecosystem Initiative. It's something that actually was one of the first projects that I worked on with The Economist, so started about 2 years ago, and we just recently kind of completed it, and we're definitely interested in sharing it with you. So it's called Towards a Stronger and More Dynamic Vaccine Ecosystem, Building Resilience Beyond COVID-19. So the Vaccine Ecosystem Initiative seeks to improve universal, equitable, and sustainable protection for everyone against diseases that are amenable to vaccination, and in order to enhance health and development, global prosperity. So it examines and reimagines critical elements for global vaccine development and the development and adoption. So this initiative actually kind of started off with initially a framework paper that explained kind of all aspects of vaccine ecosystem. So from the very beginning, from research and development, all the way to user acceptance and uptake. So that was one output. And then there were 5 different policy papers that were meant to be kind of easily accessible and quick reads for policymakers. So the first was research and development. The second was on manufacturing. The third was procurement, pricing, and financing. And the fourth was distribution, logistics, and supply chain management. And the final was user acceptance and uptake. So these were, as we viewed them, as the critical pillars for the foundation of the viable vaccine ecosystem, and we produced, as I said, policy briefs within that vein. So this project, also kind of the biggest part of it was actually the Immunization Readiness Index, which tried to make, using publicly accessible data, comparable country-level assessments, and it basically allowed us to see which countries had the readiness to respond to public health emergencies, such as COVID-19, and also what ways they could improve and maintain routine immunization programs. So it wasn't focused just on COVID-19, but it kind of, the impetus for the whole thing grew out of COVID-19. And then it also talked about the ability of health systems to harness the full potential of vaccinations. So it measured countries across a wide range of indices, of aspects. So we broke it down into 5 different domains, so to speak. And the first domain was the planning. So planning on what kind of policies, what kind of pre-planning with staff that a country has for their vaccine ecosystem, for their vaccine programs. And then the second was regulation. So what kind of regulations they had in place. We didn't necessarily measure how the regulations were implemented, but whether they had them on the books, which obviously is an important caveat. And then procurement, so how vaccines were procured, how that process was within the country. And then delivery of the vaccines, so shots in arms. And then outreach, so what kind of education they had around vaccinations. And then also just overall kind of, not really, it wasn't a separate domain, but it was more like the society, how it thought about vaccines in general. So these were the Vaccine Immunization Readiness Index really tried to bring this together in a way that's accessible, and it's online, and you can go from country level data and see how countries performed. It was not necessarily a ranking, but it's more of like a snapshot. So that's really all for this piece. Whoops, excuse me. But now to continue the discussion about vaccinations, I'd like to introduce our fireside chat colleague, Sylvia Taylor, who is the Executive Vice President for Novavax. Thank you, Sylvia.
Hello.
Hi.
Hi.
Nice to have you.
Good. Hello.
Nice to have you. Thank you.
Thank you so much for having me. And Michael, I wanted to start off and acknowledge the horrors that are going on in Israel and Gaza. I feel so fortunate to be able to be here and be safe. And my thoughts are with everybody there.
Well, thank you. Thank you for that. We're very glad everyone's here. So we have a lot to talk about in a very short amount of time, but I think we can cover some good things. So first, very broad question: where do you see vaccines going from here, and in promoting public health?
Yeah, I mean, that's a great question. I think certainly appropriate after a discussion on prevention, and I can't wait to read your readiness index. It sounds really interesting. You know, I think you and I were talking about this in the green room before this. You know, having been in vaccines for quite a while, when the pandemic hit, I thought, and then vaccines just got on the market in absolutely record time, I thought, well, this is it. Vaccines are going to have a moment. Everybody is now going to want to take a vaccine. There will be no, I'm going to remove my earring because they warned me at my bang. There will be no more, resistance to vaccines. And what we've actually seen is that that really hasn't happened. I think people who remain vaccine resistant or avoidant or just refuse them may stay that way. But I think what we're focused on is educating people about the need to get vaccinated, because COVID, unfortunately, as much as we are over it, we're sick of it, we're fatigued by COVID, it's not gone. We see rising rates of infection, rising hospitalization rates, and so the danger is still there. And so I think right now, kind of talking about the immediate future for COVID-19, it's convincing people of the need to get vaccinated. And as a manufacturer, Novavax, who makes the only protein-based COVID-19 vaccine that's non-mRNA, what we're really focused on is educating people on the need to get vaccinated, and also educating about our vaccine as an option and why that matters. And so where do we go next is really your question. I think right now we as a company, as a society, are really focused on COVID-19. We as a company are looking to go into the combination vaccine space, where you would have the ease and convenience of a combination influenza vaccine and COVID-19 vaccine. We think that's going to be really, really positive and helpful. It's one jab instead of having to get two separate ones. I think also, as a company, we're thinking about where can we take our technology platform, our protein-based adjuvanted technology platform, and apply it for places in diseases where we can do the most public health good. And so one of those areas right now that we're focusing on is malaria. So out of Oxford University, and combined with our adjuvant Matrix-M, Novavax, Oxford, and Serum Institute of India, our longtime collaborator, have worked on a malaria vaccine that is going to be a game changer and hopefully on the market next year. When we talk about the future of vaccines, we cannot forget the fact that many of these diseases for which we have vaccines are not only treatable, but they're preventable. And when you talk about something like malaria, that really comes into focus and is something that we're really proud of for the next chapter.
And that's a good segue. That was going to be my next question. So everyone would talk a lot about vaccines and COVID-19, but there's many other vaccine preventable diseases that have arguably wider economic impact, and then some that we're hoping to become vaccine preventable, like the malaria vaccine. How do you see malaria vaccine benefiting lower and middle income countries economically?
Yeah, I mean, the impact of malaria is absolutely devastating. It's actually a disease we normally think of sub-Saharan Africa. It's actually in over 100 nations in the world. Predominantly, I think 90% of the cases are in sub-Saharan Africa. And the impact is absolutely devastating. Out of 5 kids that'll die under the age of 5, 1 of them will die because of malaria. And I personally think that might be undercounted. So the toll in terms of lives lost, in terms of the economic potential lost, in terms of medical costs to manage these children who are still getting malaria, despite the fact that it is preventable by measures such as treated screens, that can avoid insects, and also vaccines. And that's where we come in with the partnership with Serum and
Right.
Oxford. I think that the death, the cost is extraordinary. But if you look at how it actually steps back progress that has been made in places like Africa, it's estimated that every year 1.3% of the progress made economically actually takes a step backward. So it's really, really significant, not just for now, but for the long term.
Right, we talked about earlier, I think about how, how many people just can't go to work because they're sick with malaria. Maybe not as extreme as dying or something, but how much economic activity is lost simply from being ill from something that could be preventable like malaria.
Absolutely. And I think we're going to see that with COVID. I think, we got over the immediate danger, the crisis of the pandemic. And I think now the focus is really going to be on not only what did we lose, but what's the economic impact? What was the impact of the past few years? What does the impact remain with people who have long COVID or people who continue to get sick and can't go to work, can't go to school? It really remains. And so that for us, as industry, a key focus of ours is educating people on the need to get vaccinated, the cost of not doing so. And I think one of the things that is most interesting in the vaccine space is the unprecedented level of partnership between the private sector, the public sector, governments, nonprofit organizations, funding organizations. We work, for example, with the Bill and Melinda Gates Foundation, who we have in a 3-year agreement that is relatively new, that we're going to use our adjuvant and our technology platform to look at how it can be used for other diseases where there's a high level of unmet need. So that's really, really exciting. But I think a lot is going to come out in the near term about what the toll and the real cost of COVID is. And I think it's really going to be staggering.
Yes, I agree. So, one of the main things that COVID, as you mentioned, you thought COVID would make it so that vaccines would have their moment. And I would say that we've also seen, unfortunately, that vaccine hesitancy has had a bit of a moment as well. So given that, and what you were saying previously, how do you see Novavax's role, and also what do you think can be done globally in order to help combat vaccine hesitancy? And it varies a little bit by country, of course.
Yeah, I mean, boy, was it naive to think, it's all going to be simple now. Everybody's going to understand, the benefit of a vaccine, and we're not going to have to convince people anymore. And we clearly haven't seen that. And so I think the way, we combat that is first and foremost education. Our role is to educate people on the availability of vaccine, on the availability of choice. We have new research that Novavax launched last week that showed that over 80% of people want to have multiple options for COVID vaccination. And that's really, really important because we get asked all the time, well, you know what, there's already another technology platform. Do people still need yours? And the answer very much is yes. We also know that 25% of people want to know that they have a protein-based option. That's also really important. So to us, that just screams education. So we educate. I think, the other thing that we really focus on is normalizing the use of vaccines. And how do you do that? Well, we do it through education, but I also think it's through the partnerships I was talking about. Governmental bodies, policymakers, global health authorities, physicians, coming together and creating policies that really instruct the people who need vaccines to get it. And then here we see a couple of continuums, right? You have in the United States, it's nearly universal recommendation for vaccination. And here in Europe and in the UK, it's typically the older and the immunocompromised. But whatever it is, creation of those policies that encourage people to get vaccinated, we think is really, really important. And as a science-based company, we're about the science, and I think a lot of the hesitancy and refusal to get vaccinated is not necessarily on a scientific basis. And so what we do is we put the information out there, we educate all of our stakeholders, consumers, providers, we work with policymakers, it goes on, to really educate about the availability of vaccine options and why it's so important to have them.
So education is very important, but a lot of times with education, it has to be presented in a way that is understandable to the lay audience,
yes.
Correct? So what kind of things does your company do that makes sure that it's not, at a level, the education is not at a level that maybe makes people feel like they understand less and maybe takes them in the opposite direction?
Yeah, well, that's actually a personal passion of mine because I am not a physician, I'm not a scientist. And I've actually, maybe I'm a masochist, I've decided to work in science my entire career. And so my particular passion is making it understandable. Because if I can understand it, right, if I can take the technical information and distill it into the very few things that are important and actionable, if I can do that for myself, I can probably do it for other people. And I've actually spent my entire career doing that. And so you ask, how do we do it? Part of it is going to forums like this and having conversations with people like you. It is through initiatives that we do, information we put out on the website. Last week in the United States, and it's going to be coming to Europe soon, we launched a PR campaign that is seeking to educate people, not on a particular vaccine option, but on the fact that you should get vaccinated and that options exist, because we know that options drive choice and drive the behavior we want to see, which is vaccination. So it's really distilling things that can be really complicated. You know, what is this variant? What's that variant? What's Omicron? What's a lineage? Why does it all matter? At the end of the day, it matters because COVID is still present. And what can that mean for you and your family? You know, we see with vaccines, we often say no one is safe until everybody is safe. It's not about me, it's about us, right? It's about vaccinating yourself because you care about the people around you. It's about if you're people in my age cohort. It is taking care of your loved ones, feeling a sense of responsibility for your loved ones, to get them vaccinated, to understand what their options are. And so, you know, for us, it's meeting people where they are. If you're a healthcare provider, we're going to talk to you in a very scientific way. If you're a policymaker, we're going to talk to you in terms of policy. And if you're a consumer who needs the information, we're going to talk to you in very simple terms. We're going to put a lot of the information out there. You know, what we saw in COVID is that there's an unprecedented level of interest in the science behind vaccines. You know, typically, when I go get my annual flu shot, I don't ask for a particular brand. Now I started asking the pharmacist, because in the US you go to pharmacy and you get vaccinated. What are you giving me? And they're like, huh? And so you know, it's providing a continuum of information so that if people want to keep it really simple or they want to get into the science of it, we have it all. So
Right.
spend a ton of time doing that education.
And I worked on health education for a long time in my career with the CDC and the
Yes.
Centers for Disease Control Prevention in the United States. And plain language education that was understandable for the lay public, and also things with, you know, sometimes graphics and pictures and things for people that maybe have low literacy, and then also doing things in other languages. You know, Europe is so varied. You really need education in multiple different languages, not just.
And I'm so glad you said that, because you're reminding me that, you know, our website, we've translated it into multiple different languages. We have different websites for different countries, right? So it's this idea of meeting people where they are in the way that they need to see the information, whether it's pictures, whether it's graphics. We've done videos showing how our vaccine works. You know, we do infographics on the cost of vaccination. So there's a lot of information there. You know, the bottom line is, people need to receive the information from trusted messengers if they're going to act on it. And your trusted messenger may be a member of your family, it may be your physician, maybe your local pharmacist, whoever it is. Our job is to put the information out there so that people can access it and understand it.
Exactly. Unfortunately, just like the other session, we have about a minute left for any audience questions. So if there are any audience questions, we'd love to hear some now.
Hey, yeah, I think it's very exciting that you're planning to put the flu vaccine and COVID vaccine together. I think they'll perhaps improve take-up rates, etc. But we've seen that mRNA vaccines are perhaps more effective at preventing the disease, etc., than the protein-based vaccines. Are you planning on sticking to the protein-based formula for this? And what's the timeframes of bringing this to the market?
Yeah, that's a really good question. I'm actually not aware of the information that you're talking about, the data. You know, I think what we focus on as a company is that a diversity of vaccine options are really what's necessary. You know, you cannot put all your eggs in one basket. You cannot put all your eggs in one technology platform. You know, there are advantages to a protein-based, more traditional vaccine platform. And, you know, everything from a good consumer profile to storage. You know, our vaccine doesn't need to be frozen. So we think all of those things are really, really important. You know, it's interesting also when you think about a combination product, right? There is something about the protein technology platform that is adjuvanted that allows you to add a lot more antigen, right? And so we think that moving forward, that's going to be important when you combine multiple antigens into a combination vaccine. And we're excited that we're taking that forward. We're in late stage development, and it should be through clinical development in a couple of years.
Great. Thank you very much for the wonderful conversation. I know we could talk
Absolutely.
a lot
Thank you.
longer for this. Thank you very much.
Great. Thanks a lot, Michael.